Reagan, along the lines of treatment and accountability, I have seen some numbers and some accounts from states, maybe even one from Washington, not necessarily in King County, but when you put folks through a program, through a deferred adjudication program, how important is it to follow up, to have accountability from the state side or the county side or the city side on making sure the folks who are in the program are following the steps and are being held accountable, so that they can have the opportunity to get themselves taken care of and break that cycle?
About a third of the people that get sober get through the court system. So you have to have follow-up. If you don't, people won't see their consequences. I mean, to get sober, you have to bump along the bottom. If you hit a rock, that's when you decide to get sober. The legal system is that rock frequently. And so we have to have that accountability.
So the legal system has to do its job. You got to be willing as a policymaker, as a leader, to hold folks accountable, even though you may hear some negative feedback.
Yeah, you have to weather the storm and realize that it's important to have those consequences, and then make the treatment options available as well. And that's really important. And cost should never be a barrier. Somebody has to come up with $10,000, they're not going to get treatment. Knowing how to get the treatment's important, right? Those blockades are important. Also, and I can talk about this stigmatization. 90% of the public won't go to treatment because they're afraid with the stigma being associated as an addict. That's serious.
So talk a little bit about that, about King County has been very intentional on destigmatizing this and recognizing it, that these are people. These are men and women, young and old, really across age as well. But talk about some of the campaign and communication and work that y'all have done there to make treatment more palatable and more acceptable.
It's like you want as many tools in the toolbox as you can get. One of the tools is to destigmatize, and we did this awareness campaign called "Don't Count Us Out," which is just people recover, they lead fully productive lives, and there's a lot of stigma. And again, 90% won't get sober because they're afraid of the associated stigma. So that's what we did here. We won an award for it, and it directs people to understand that if somebody can get sober, they can turn their lives around and be a productive member.
Have you seen that picked up in other communities, either the county level or the city level?
I haven't seen if it's been picked up, but we presented recently at a conference nationally on it. So it's starting to get there, and it's one of 100 programs you need to have to get folks into the treatment options. And so, financial barriers got to bring them down. Access, just the information, this kind of program, public officials coming out and talking about their challenges that we need to see more of. Even celebrities as well. So it's part of the solution, not all of it.
So there's a level of honesty, a level of transparency, and of course, a level of accountability that makes all this work. And that's one of the things that we have seen over the years. We've been engaging with municipal and county leaders for over 10 years, and it's the R&D, the rip off and duplicate, the beg, borrow, and steal solutions across the country. And we've seen it on homelessness. We've seen it on workforce development. We've seen it around opportunity, where folks are able to innovate by borrowing from, if not a shoulder buddy, someone further on across the country. And this is one of those things. I appreciate the leadership that y'all have done in King County, that you've done there. And the 9th Council District, helping make that happen. And of course, we hope that regardless of who's watching this, they take this information and run with it and apply it in their own communities. Reagan, as a longtime observer and responder to what's been going on here, what we've been talking about here with addiction and substance abuse and all the contributing factors, what's the path that community leaders and counties, cities, and towns, what's the path they need to chart to prevent and ultimately recover from this? And that's a gigantic question. I fully recognize it. But we have you for a few minutes, and just to get what that framework looks like, what, your fellow county council members or supervisors or judges or whatever it is, or mayors and council members, what are the things they should be doing, can be doing? What are the flags? What are the markers? What are the waypoints?
So, I mean, you've got to have a robust prosecution system. That's important. You have to have the kind of facilities that can take people in and treat them. And we don't have that. We did a services survey recently, and we don't have nearly the beds we need for this sort of thing. That's important. And in your slide, you'll see a crisis care center levied $1.2 billion in voter approved to build 5 facilities across the community to do just this. That's hugely important. And that's a big one for us. So that's part of it. So you're building the infrastructure, you're building the intake, which is law enforcement, arrest, prosecution, treatment, or through jail, which is a good way to get treated as well, ultimately. You've got to have public service and public health organizations understanding this important role of dual diagnosis, where anxiety, depression, all kinds of things can cause somebody to get addicted. And those are important, treating those as well. Follow up, the availability of information, awarding people who are doing a great job. We have a special award for this every year. And then the follow-up care is critically important. And sometimes, statistics tell us that about 75% of people who go to treatment will relapse in the first several years anyway. And you got to understand that it's a continuing commitment. Sometimes you have to go again before you can get sober. So you have to have that infrastructure in place. And I think those are the biggest chunks of what we need to do to solve the problem. I'm not sure that the dare to keep kids off drugs thing that Nancy Reagan was doing will work today, but there needs to be a concerted federal emphasis on it. And, the DEA is hamstrung in a lot of ways, but you really need a drug czar, both in the federal government and every state government, to focus in on this issue with an even balance of treatment and law enforcement experience to make these halves work.
Reagan, you've talked numerous times about treatment and law enforcement. Would you call it compassionate accountability?
I think it is. I think the most compassionate thing you can do is, arrest somebody and have them enter the system here. If you don't, they're going to die. So
right.
We can't treat anybody who's dead. Month after month, I have people coming to me and their child died of an overdose. Not always poor communities. Wealthy too.
Right.
And so these systems that we're talking about really are designed to sort of stop short of that. And if you have to have some tough love, then you do. That's important.
Right. Reagan, what other communities, or are there other communities that you have borrowed from in y'all's approach there in King County?
Yeah, Connecticut's got good programs. Michigan does as well. Ohio, but a lot of it is go as we figure it out locally, which we need to do more sharing. Here's some things that I've done, legal protections and support privacy and online groups, or those sorts of things. But we need best practices from the federal government to show us what we need to do in addition to this information sharing that you're doing as well.